I want to just start by saying that I understand Medicaid is a state-federal partnership. For the last 24 years, I've worked in state government in funding nursing homes and hospitals and providing for care in our state. I have a letter, Mr. Chairman, I would like to submit for the record from rural hospitals in Ohio talking about how the most recently passed legislation is so helpful to them.
Without objection.
It will increase funding for rural hospitals in Ohio by 24%. Previously, they were receiving 91% of the Medicare rate after the passage of the bill, and by subsequent actions by our partners at the state level, they will be receiving 115% of the Medicare rate. That does not mention the fact that we also have a $50 billion rural hospital fund that's available, even though rural hospitals only received $10 billion in funding total, according to CMS last year. So I just want to submit that information and make sure we have those facts available. Now, Ms. Stevenson, we've talked a little bit briefly about cybersecurity breaches and the challenges that are faced. I know that we talked a little bit about rural hospitals and the fact that really it's in some cases a talent issue. You know, can you find the people with the cybersecurity skills to be able to accomplish the defense that's necessary? What suggestions do you have on how we can help? Because I know some of the things that we've done in Ohio have been establishing cybersecurity as a high school program at our career centers and in partnership with business. So are you working with any of those collaborations at the local level with our educational institutions to build the cyber talent that you need to help serve you?
Thank you for that question. Yes, absolutely. One of the things we focus on in Norwalk is connection to our local colleges, high schools, and even to two-year colleges to engage them at the intern level so they get exposure to healthcare and get experience in the real world, whether that be IT or cybersecurity. We very much agree with that approach and want to take a thought back to when Meaningful Use came out years ago, and we put out there grants and programs to provide more education on meaningful use in informatics back then, and is that an opportunity for us to try that again with cybersecurity, given the new focus going forward, to encourage young people to go into that path? But yes, we absolutely are partnering with every education opportunity that we can.
And you had also mentioned the need in your remarks to move away from punitive policies that punish providers when they have a hack or a cybersecurity breach, and then a vetted directory of third-party vendors would make it easier for rural hospitals to enhance cybersecurity. Could you expound on that a little bit?
Absolutely. One of the challenges we have as we partner with, whether it's a vendor or an external consultant or any organization that we might work with, is ensuring that they have as much protection around the data that we do, because the patient's information flows through all those places. The burden right now is on each of us to vet that. So I need to submit system assessments to a particular vendor, ensure that they complete the information and they have a robust program before I can even contract with them to do the work. And that is very burdensome for us to have to do that, and every other healthcare organization in the area have to do the same thing. So if there was a standard set of privacy and security rules or regulations that they all needed to follow, we could have more trust in that and remove the burden from everyone of doing duplicate work.
And where should that be? Where should that home be for that list? Who should be responsible for it?
That is a great question, and I don't think that I have an exact proposal for that. I think we have some amazing cybersecurity groups in the works right now, whether that's Health ISAC or CISA or any of those organizations. I think that would be a recommendation of the Senators, Congress.
Well, it's interesting. I mean, you know of the resources that we created in our state with the cyber range, and we literally have at the National Guard a cyber militia. We think of militia as people carrying weapons. Well, this is a group of of cyber militia that's literally trained to help respond in times of crisis, I think it's probably underreported, underutilized, but those are kind of resources that I think we can all help and create. Thank you, Mr.
Absolutely.
Chairman.